Welcome to this week's video. We're looking at sciatica pain and more specifically what you can do at home to help relieve the pain. Okay, so sciatica, what is it? Well, let's begin with the sciatic nerve. This runs from your hips to your feet, and when it becomes irritated, it can cause pain in various areas such as your bottom, the back of your legs, your feet, your toes. All these areas can get some form of pain. This pain, it can range from a burning or shooting sensation all the way to tingling, to numbness and even weakness. And these symptoms may actually get worse during normal everyday activities. In fact, even coughing and sneezing has been shown to sometimes make sciatica symptoms worse. Now, this is a very brief overview of sciatica, but what I will do is leave much more information in the description below about the condition, about when you need to speak to a doctor, and when you might need emergency medical treatment. So please read the description below. I'd highly recommend you do so. Now, the next question is, what can you do to help relieve these sciatica symptoms? And that I am going to tell you. Okay, so the good news is that sciatica usually gets better within 4 to 6 weeks, but it can sometimes take a little longer. And there are many things that you can do to help relieve the pain and speed up recovery. Now, we know that the most important thing that you can do is to remain active and continue doing your normal daily activities. This is going to help the sciatica pain the most, and it's something that I tell all patients. But if you can, try and incorporate these 5 simple daily stretches into your life, and what it's going to do is going to help reduce your sciatica pain, and it's going to help strengthen and improve flexibility in the region too. So let's learn the moves. Let's begin with a simple knee to chest stretch. Lie on your back on a mat or carpet, bend your knees and keep your feet straight and hip width apart, keeping your upper body relaxed. Next, bend one knee up towards your chest and hold it with both hands, stretching as far as is comfortable. Aim to hold this for 20 to 30 seconds and repeat 3 times, alternating legs. Next up, we have the sciatic mobilizing stretch. Lie on your back, bend your knees and keep your feet straight, hip width apart, keeping your upper body relaxed. Now, to begin the exercise, hold the back of your upper leg with both hands. Next, slowly straighten the knee. Aim to hold this for 20 to 30 seconds, taking deep breaths, stretching as far as is comfortable. Once you're done, bend the knee and return to starting position. Repeat this 2 to 3 times, alternating legs. The good news is we're now past the halfway point, so the next exercise is the back stretch. To begin with, lie on your front and rest your forearms with your elbows bent at your sides. Look towards the floor and keep your neck straight. Now, while keeping your neck straight, arch your back up by pushing down on your hands. If this is done right, you should feel a gentle stretch in the stomach muscles. Breathe and hold this for 5 to 10 seconds, then return to the starting position. Repeat this exercise 8 to 10 times. Next up, we have the standing hamstring stretch. So stand upright and raise one leg onto a stable object such as a step. Keep that leg straight and your toes pointing. Now lean forward while keeping your back straight. Please make sure you don't arch your lower back and hold this for 20 to 30 seconds while taking a deep breath. Please make sure to stretch as far as is comfortable and repeat this exercise 2 to 3 times on each leg. And for the final exercise, we have the deep gluteal stretch. To begin with, lie on your back, bend your left leg and rest your right foot on your left thigh. Now grasp your left thigh and pull it towards you. Please keep the base of your spine on the floor throughout this and your hips straight. You should feel the stretch in your right buttock. Hold this for 20 to 30 seconds while taking deep breaths and repeat 2 to 3 times with each leg. So that's the exercises, and a big thank you to Mo, my personal trainer friend, for helping me show you these exercises. Aim to do the exercises every single day along with other activities such as swimming, walking or yoga. All of these can really help, and you should start seeing improvement within 2 weeks, and hopefully the pain should pass by 4 to 6 weeks. But please remember, if your pain doesn't improve within a few weeks, the pain is getting worse, or you experience severe pain when doing any of the exercises, then stop there and make an appointment to speak to your healthcare professional as soon as possible. As I explained at the start, I will leave a full list in the description below on when you should seek medical advice, and I would highly recommend everyone to read it. Now, in addition to these exercises, heat packs have also been shown to be quite helpful when placed directly on the area of pain. Please remember, try not to sit down or lie down for long periods either. I know it might hurt to move, but it's not going to be harmful for you, and it can actually help you recover faster. Now, there's also a few other things that you can do to help prevent sciatica from coming back. So obviously one of them is doing regular exercise and maintaining normal daily activity, but there's also a few other things. So for example, lifting things with the correct posture, having a good posture when you're sat or standing, and also if you have a desk job, if you sat on a computer all day, having it set up correctly. This is all going to help. Now, the NHS have some really useful articles on all of these, so what I will do is I'll leave a few links in the description below, and I'd highly recommend you check them out. And if you are overweight, losing weight can also help with sciatica. Now, I have made a few videos on how to lose weight, looking at evidence-based ways on how to lose weight, so they are really useful. If you haven't seen them, I'll leave a link up here and in the description below, so please check them out. Also, lastly, smoking. You need to stop smoking, because smoking, not only does it cause various different diseases and cancers, but it has also been shown to increase sciatica pain. So if you can, please quit. I'll also leave some really useful links by the NHS on how to quit smoking and all the resources available around you. I really hope my tips help you in this week's video. Please let us know how you got on with the exercises, and if you have any of your own tips, leave a comment below because I'd love to read it, and I'm sure everyone watching this video would too. Always remember you're awesome, and I will see you next week. 2 weeks for this. Honestly, this is some very well-deserved cake. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.